Hello, my name is Eric Veilleux. I have nothing to disclose. I will be presenting our research titled Revisional Band to Sleeve Gastrectomy, the Cost of Staging Bariatric Procedures. In discussing revisional bariatric procedures, it is important to first discuss obesity as a chronic and progressive disease. If we think of obesity in the same category as cardiovascular disease, it becomes more acceptable to imagine the need for revisional procedures for long-term control and maintenance of the condition. Thus, revisional bariatric surgery is becoming more and more common each year. Still, however, controversy exists over revisional algorithms, which operation to choose, and whether or not to stage revisions. In our study, we examine a single surgeon's experience with laparoscopic gastric band conversion to sleeve gastrectomy. We looked specifically at the outcomes and costs associated with staging these conversions from gastric bands. In our study, we examined 64 gastric band patients, 31 of whom had a single stage conversion and 33 who had a two-stage conversion. Additionally, we examined a cohort of 64 primary sleeve gastrectomy patients in order to compare average weight loss. Follow-up data up to 1 year was analyzed for excess weight loss. Additionally, OR time, complications, and cost were analyzed. We had similar BMI for all groups. When looking at weight loss, we did find that our mean excess weight loss at 1 year was higher for the primary sleeve group at 50% excess weight loss than it was for either of our revisional groups, both at 28% excess weight loss. Among the revisional groups, average excess weight loss at 1 year was equivalent regardless of staging. Leak rate was 0% for all groups, revisional and primary. Mean operative time, although 10 minutes longer on average for the two-stage group, was not significantly different between groups. Aside from outcomes, we also analyzed the cost of our revisional operations to further guide the optimal algorithm for revisional surgery. We found that a two-stage procedure was more expensive by approximately $4,051 per case. Although staging creates a higher cost for the healthcare system, in the United States, the surgeon sees a higher reimbursement through staging by approximately $860 per patient. In conclusion, the analysis of our single surgeon practice shows that single stage revision from gastric band to sleeve gastrectomy is as safe and effective as two-stage conversion with an overall leak rate of 0%. Thus, performing the conversion in one stage will benefit the patient as well as the overall burden of debt of the healthcare system. Surgeon reimbursement in the United States currently favors performing the conversion in two stages. We believe this deserves reevaluation, where quality or optimal outcomes and utilization of healthcare resources is rewarded rather than quantity. Thank you very much.